Is healthcare in Spain really free? Is that true? If so, what are the requirements? I will answer all the questions and I will share my experience, but I'm getting ahead of myself. There are things that happen to me that no one has told me about, and they might be very helpful to you. Hi, I'm Piña, 7 years enrolled, 18 countries visited with Jack, and I recorded this from Spain. If you don't know me, I will tell you about the opportunities you can access and what the experience really like by country. And I will tell you upfront that is very different from what you see in YouTube videos. After several months of trying the public healthcare system here, I have registered, had my appointment, my routine checkup, and received the result. But there are many unexpected things along the way. What can I access? What services are available? What is the coverage? This video is part of the Spain Life Arbitrage Index, where we rate each city and country we live based on the opportunity it can offer. If you are not familiar with the Life Arbitrage Index, you can see the previous video. But don't worry, you can see it after they finish this video. So if you want to access to the healthcare system in Spain, I should mention the requirements are short and basic. Only you need your passport and your registration certificate. It's called here empadronamiento. But what is that? You have to go to the town hall registry to prove you actually live where you say to live. I'll mention this in advance and it's important. Take attention. If you are staying in hostel, Airbnb or any hotel, this contract probably won't count toward your registration. This document can be used immediately or a few days. It's a document like that. Then you have to wait 3 months from the day you register before enrolling in the system. The 3 months rule exists because tourists can take advantage of this. Its meaning is for long stay. But here is the important point. If you have an emergency, they are also obligated to treat you even if you are not registered. However, if you are sick during this month, they won't help you. Once the 3-month period has passed, take this document to the closer health center to your registered address. There, they open a file for you, give you a temporary number, and inform you that the physical card will arrive by email once it's been accepted. From that moment on, you can request your appointment with your doctor, psychiatrist, or your dental. But in other way, if you get sick before these 3 months, you won't be able to go to the healthcare center with your doctor. I learned it the hard way. I got sick before the 3 months were up. At the health center, they told me to come back when the waiting period was over. The only public option here is the emergency room. So they told me go to the private clinic. It will be cheaper than what we will charge. The pharmacy won't give you the antiviral medication, for example, without a prescription. I tried several times as well. So I recommend you a travel freestyle kit and travel insurance that covers this situation. So what's happening next? Once I go through the wait, I went in and was given an appointment 3 or 4 weeks in advance. That time frames vary by centers. Some clinics book you in 2 weeks, other in 4. The wait depends on the center. So other problem can be some centers don't have a dentist on staff, so they refer it to another center in the city. My primary care physicians gave me my annual checkup, urine sample, but they give you the bottles too, blood draw, and also an electrocardiogram. Then at the final, you can have an appointment with your doctor who review everything. I also asked him for review my vaccine record and added the ones I was missing. So until this point, as you see, I went to the several appointments, but no one until this point cost me any money. Now we're going to the dentist side. There are also many limitations. You have your appointment and the dentist can do a basic checkup, extraction if you need, or treat an emergency. But cleaning, filling, crowns, root canals, full restoration, or a small one, none of these include. Even my clinic didn't have an X-ray machine, so they refer me to the large hospital of the city. Then a follow-up appointment to read my blood. And in the end, they give me some recommendation, good preventive advice. Now, the important thing here, regarding in the cost, as you see, I use the service a lot and I haven't paid for a consulting, lab test or referral. Other important thing is about medication. If you need it and if you have the healthcare card, the medication here may be a subsidized percentage once the healthcare is approved, but it depends of the case, this percentage. Also take account each center keeps on file on you. If you want to move out and change the address, I recommend you to go to the healthcare center and tell her about. And now for a special occasion, if you want EU passport and move to Spain, you only need to bring the S1 form from your country of origin and submit it to your assigned health center and you have a full coverage. That was my situation, so I don't have too much information about this. But now, the answer to the main question, is Spain public healthcare free? And the answer is, well, it depends. Until now, yes, it has been, that's true, but it's also subject to conditions. There are a waiting period, this is a different than 3 months I mentioned, and they have an internal decision making, a process that determines whether you haven't paid anything or if you have to pay to the state later. So I am in limbo right now because I still haven't received my health card. It's not entirely clear to me what are the criteria for denial, for example, even after asking, and I don't know how they take the decisions. So my approval is still pending. For now, all I can do is wait for response. Until then, the most accurate statement I can make is this: the free Spain public healthcare system is real, it's worked very well. 3 to 4 weeks for requests to an appointment, and they were always very punctual with the time and days of the appointment. So this is part of the bureaucratic identity and path axis 5 of the Life Arbitrage Index. For Spain, you can stay up to date at the lifearbitrage.co. Follow the channel to see whether the card is approved or denied, as well other experience to come.